Welcome to Health Source of Harrodsburg, Kentucky. Today's topic, treating common household injuries. It is often said that most injuries take place within the home. The truth is that many injuries do occur within the one place most of us consider safest of all. Most of these injuries are the result of accidents around the house, and most are easily treated with a little first aid. Cuts and scrapes. Most minor cuts occur in the kitchen. While it may seem counterintuitive, a dull knife is a greater danger than a sharp one. Most kitchen knives haven't seen a sharpener in years. The result is that you need to apply a great deal more pressure to cut anything, and the knife can easily get away from you, resulting in a cut finger. As long as the cut is fairly shallow, wash it out with plenty of soap and water, and then place some direct pressure over the cut with some sterile gauze to stop the bleeding. Use a little antibiotic cream and bandage the cut. Keep it clean until the skin has fully healed. Scrapes are much more common when you fall. Once again, you will need to wash out the scrape to ensure that all dirt is removed from the injury. A little antibiotic cream and a bandage should take care of the problem. Sprains and other muscular injuries. Overuse, rapid movements, trauma, or any number of other causes can lead to sore, tired muscles. Unless you're experiencing any numbness, treatment involves ice, rest, and gentle stretching. If you suffer from a more serious strain, you may be asked to come in to see the doctor, and a sling may be prescribed. Icing and anti-inflammatory medications help keep pain to a minimum, as well as reduce any swelling. Rice, the traditional formula of rest, ice, compression, and elevation, works exceedingly well for these kinds of minor injuries. Falls and breaks. Falling in the bathroom is one of the most common household injuries. For the elderly, it can be particularly dangerous as well. If you fall and hit your head, it's advisable to call your physician, since they can recommend the need for follow-up care for a possible concussion, especially if you passed out for any length of time. Breaks can come in several subcategories, but if you suspect that you may have broken anything other than a finger, which can be splinted, this injury will require a trip to the doctor at the very least. X-rays will show which bone is broken and how it will need to be set. Minor breaks usually take about 6 weeks to heal. More serious breaks will take longer. Most people will experience a wide variety of minor injuries in the home. Planning ahead by stocking a good first aid kit, knowing basic skills, and remaining calm are your best tools. Ask your doctor or practitioner how to build a first aid kit that contains everything you need to deal with minor injuries, and let them help you determine at what point to head into the office. To find out more information on topics like this, please go to www.healthsourceofharrodsburg.com.